overarching concept of the E8 regional platform and strategy is the interconnectedness of countries which share related populations, economies, epidemiologies, and ecologies. I said we are dealing with vector mosquitoes, and the member states, they share the economies. And as a result of this, there is stark realities, a challenge to the health security of each country and the region as a whole. Countries, as sovereign states, govern, dictate, and implement health policies and strategies within their jurisdiction. We had been urging member states to see to it that domestic funding is upped. However, inter-country importation marks a significant bottleneck to malaria elimination across the region, and policymakers must come together to implement a harmonized strategy that cuts across political boundaries in order to attain the collective vision of a malaria-free SADC and AU. You know, AU's target is that of 2030, SADC 2030. Therefore, it's the same for Elimination 8. You may also wish to know, Sharon, we are talking of E8, just Elimination 8. A few years ago, together as a team that is at E8 Secretariat, we felt the need, whenever we would meet on an annual basis, some member states, like Malawi, they had been voicing out to say, why is it that we are not included into this good initiative? And we worked, that led us to consider getting to SADC Secretariat. I had the first visit to SADC Secretariat, I think about 5 years ago, just engage them, to introduce to them what is E8. And the current executive secretary, Dr. Tex, in fact, I recall 3 years ago, she wrote me a kind letter, a good letter, commending what we were doing, because she came to know the importance of Elimination 8, and then the thoughts of engaging the entire SADC member states. And then we had another follow-up. Then I went together with Kutsai Makolo. Kutsai was the first coordinator. Maybe I should put it as the second coordinator, because when we engaged at the inception, I was entrusted by my colleagues that we should serve as a secretariat. And Dr. Norbert Foster, you may wish, I think you know him. At the time, he served as Deputy Permanent Secretary. He initially was the first coordinator of this initiative. And then we were entrusted to come up with a secretariat. And we went for a manhunt. And then we brought on board Kutsai Makolo, a Zimbabwean national. Together we went to see the executive secretary. And we felt the way to go would be to come up with a declaration where the heads of state and government would commit themselves. And I'm happy to report that, to cut this story short, was agreed. And 2 years ago now, here in Windhoek, when Namibia served as a host or the chair of SADC, during that summit, the heads of state and government, they signed a Windhoek Malaria Declaration, where the heads of state and government committed themselves to, one, sharing data. Because it's only when you share the data, when you know your neighbor has a challenge, that you can support. With the data, the secretariat, which holds the expertise, would be in a position to assist those member states who are struggling in terms of controlling malaria, leading to elimination. Secondly, the heads of state and government committed themselves to Abuja Declaration by committing themselves to uplifting domestic funding to the ministries of health so that they can see to it that this initiative is indeed supported. Then you also want to know, in terms of the initiative, the project implementation, funding and coordination from 2019 to 2020. Sharon, you may wish to know, I think first is the funding. We agreed as ministers that member states should see their own budgets in terms of salaries, in terms of medicines, chemicals, spraying. However, there was need for funding the secretariat. And then that brings on that element of the partners. And that's how we approached the Global Fund. It is an open secret that I want to state here that the first budget, which was more than 18 million US dollars, it was the initiative of the chair and Kutsai Makova, the then coordinator, that we went to see the executive director of the Global Fund. Of course, with the support of Sir Richard Fisher, who served as the first Global Fund executive director. Now, how have we been working? First, we established what is known as the E8 scorecard, which is a tool that the E8 member states use to track their progress on a set of indicators. Indicates that countries have made significant progress in reducing the burden of malaria through the implementation of the WHO recommendations. However, let's admit there are challenges that still persist. The major challenges of lately, especially this year, is that of the 2020 plight on the COVID-19 pandemic, which challenged our health systems in terms of, leading to the member states to think outside the box. Some of the challenges that COVID-19 posed on the malaria fight included, one, the restrictions in movement. Excuse me. Hence, the regional coordination meetings have gone virtual. Recently, about a month ago now, the SADC held E8 annual ministers meeting. It was virtual, coordinated from here. High rains and high temperatures are being recorded throughout SADC. contributing to increased malaria cases. Community interventions have been disturbed by national lockdowns and restrictions such as active case surveillance, testing and treating, indoor residual spraying, and community education on how to prevent. You know, you have to educate the communities in terms of the signs and symptoms of malaria. How do you do that? You must get to the member states, to the communities themselves. Educate them what needs to be done. But with COVID-19, you are told social distancing. How do you do it? The lockdowns, how do you do it? Procurement of insecticide has slowed down significantly due to manufacture not producing at scale. There is a stark challenge in terms of realities that, look, WHO recommendation says if you are to do your indoor residual spraying, coverage should be above 80%. Is this being realized? I can tell you, not all member states. Even here, where we are, they are not. So these are some of the challenges. The other aspect, COVID-19 pandemic, in terms of malaria funding, yes, it's a significant challenge as well. You see, with COVID-19, with all its threats, the fears had led resource, channels to affect funding malaria negatively. This is very clear. Governments needed to divert unplanned resources to fighting COVID-19. This was not planned, and ensure that systems are in place to contain the outbreak in a very short space of time. There is a talk of the new normal. Yes, but challenges remain. That can impact a health ministry's fiscal space. Additionally, ministries of health had to procure the now known PPEs, personal protective equipment, for the health workers, the doctors, the nurses, those who are engaged, the drivers, you name it. These were resources that were not planned. The E8 worked to mitigate this. How? By increasing advocacy with the ministers of health, highlighting the gains made in malaria and the threats of reversal of progress should resources be compromised.